warm weather is upon us, and here in Canada over the last decade, the number of Lyme disease cases have increased by 1,000%.
Wow, so here with what we should know to keep ourselves safe is Dr. Sheila Wijayasinghe. So it's so good to have you. Good to see you.
Yeah, I'm so glad we are doing this topic, and let's start with the basics. What is Lyme disease exactly?
So Lyme disease is a potentially serious infection that's caused by a bacteria that's transmitted from ticks, deer ticks, or they're also called black-legged ticks, to humans. And it can result in very severe symptoms that are really long-lasting for some people. So I'm so glad that we're talking about it. Interestingly, Lyme disease, before 1975, we didn't know what it was. And it was a group of mums in Lyme, Connecticut, who actually found out that there was a cluster of kids getting juvenile rheumatoid arthritis, being diagnosed with this. They're like, something's not right here. And they pushed for it, they spoke up, they advocated, and research was done to discover that it was actually from a bacteria that could be treated.
Wow.
And so it's really, I'd love to take a page from that we speak up. A lot of people suffer with Lyme disease. I'm glad we're talking about it because there's things that we can do to prevent it and treat it.
That's
so good.
fascinating. All right, so if you get bitten by a tick, do you automatically develop Lyme disease?
It's a great question. There's more than 40 types of ticks out there. Very specific ones carry the disease. And the truth is, for a tick to transmit the bacteria to you, you have to have it attached to your body for at least 24 to 36 hours.
Okay.
So it sounds really gross, because it is, but it's true. It has to be that long time. But it doesn't always mean that just because you got bit doesn't mean that you have it automatically.
Okay, that's good to know. So where do ticks like to live? And can the naked eye spot a tick? And how do we know it's carrying the bacteria?
Yeah, we don't know just by looking at it, and actually it's tiny. So it's about 2 millimeters in size, so about the size of a poppy seed. And and they like to live on tall grass, wooded areas, like large bushes. And so you have to be careful. So what ticks do is that they actually are attracted to carbon dioxide, and they sit on the top of grass and sort of like sit and just kind of do this. And they attach to anything that's going by that releases carbon dioxide. We release carbon dioxide, and animals release carbon dioxide, so they attach in that way. But we can't see them all the time, and we don't always feel them when we get bitten, which is why it can be difficult to know.
Oh my gosh. Okay, so I don't think I've ever seen, like what you just described right there. I'm like, I've never seen that before. So what should I do, or what should people do if they actually see one, or if you're bitten by one, you see one attached to you?
Yeah, so this is a really great, I think when we see something on our body, we automatically want to yank it off and take it off really quickly. But what I suggest to my patients is take a moment, take a deep breath, and then what we need to do, this is what it kind of looks like, where the head gets a bit embedded into the skin. And what we have to do is take it off very carefully, because you don't want to crush it, you don't want to leave a part of it in your body. So take a moment, because again, it takes that time for it to transmit. It's not right away. It can take 24 to 36 hours. So you have a bit of time, but you want to get it off as quickly as possible. You use tweezers, take the fine tip tweezers. You can also buy them online. There's a great organization called Canadian Lyme Foundation, and they actually sell the tick removal. You put it at the bottom, grasp the tick as close to the skin as possible, and gently pull it up. Because you don't want to twist it and leave a part of it in the skin. After you've removed it, rubbing alcohol or soap and water on the area. And then what I suggest to everyone is make sure that you get help, seek out care, because if we can treat you, if you've had a tick on for 24 hours and you're not sure, we will treat you with preventative medication early on to prevent it from developing it.
That's great to know.
Yeah.
Okay, symptoms. What do we need to look out for? Like you said, we wouldn't feel it if we got bit.
Right.
And you might not even find it.
Yeah, and sometimes the tick does fall off on its own, so we may not know. So if you've been in an area where you're worried about ticks, which is very common, actually, we are seeing it in cities as well now, it's important to get help. You may have symptoms like flu-like illness in the early stage. So you might have like fever, myalgias or muscle pain, weakness, and fatigue. And then you get this classic rash called a bullseye rash, which looks like this. It has like a classic appearance. On darker skin, it might look more like a bruise. So it's important to know it looks different on different people. And what's important then is if you have that, it happens usually within the first few weeks, we can treat it. Later on, there's different stages of Lyme disease. There's early disseminated Lyme disease and late disseminated Lyme disease, where we actually start to see symptoms where it actually gets more embedded in the body, and we get symptoms like arthritis. You can get symptoms of cardiac involvement, so palpitations, heart issues, or nerve issues like facial palsies, or your nerves aren't working in the same way. And those are more severe conditions where we do sometimes need hospitalization.
Wow. Is there any testing for Lyme disease?
That's a
if a
great
person's concerned if they have it?
Yeah, so research is being done to improve testing, but right now what we have is an antibody test. So what the antibody test does, it test to see if there's antibodies, so a reaction to infection. But that can take anywhere from 4 to 6 weeks to develop. So someone in the early stages, maybe they have a rash, and about only 70 to 80% of people will get that classic rash. Not everybody gets it. So we can sometimes miss it in the early stages because the blood test doesn't go positive for a little bit. So if someone has symptoms, the key is that you might need to get retested again, or we treat you based on your symptoms and what your exposure risk was.
Okay, so let's talk about the treatment, and then like, what does it cure it? Like, is there a cure for this?
So in most people who get treated, we treat with antibiotics. If we can get to you treatment and prevention before it actually sets in, that's within 72 hours of removing the tick, that's very helpful. If you're in the early stage, we treat with antibiotics for anywhere from 10 to 14 days, up to 28 days, depending on your severity of symptoms. The truth is, most people do get better, but there are many people who actually have chronic Lyme disease or post-treatment Lyme disease, which can last for months to years, and it's very debilitating. So it's very important that we do talk about it, because there are things that we can do, but it's not 100% treatment. We need to do more research to support these patients.
Okay, so I like the prevention part of this. We're out and about. People are going for hikes. They're in forests. I'm walking my dog in tall grass.
100%.
So how do we prevent or protect ourselves?
Yeah, prevention is so key in this area, and what we can do are things like when we know you're going out, have a tick removal kit. If you're out a lot, wear protective clothing. So long sleeves, tucking your pants into your socks doesn't look great, but it's helpful to prevent the ticks. Wearing light colored clothing because you can see the tick more easily. Tick repellent, you can get that. You can use it on your clothes or on your body directly. Just make sure it's safe to put on your body or on your kids' bodies. If you're on a trail, stay on the clear part of the trail, not on the grassy part. And most importantly, to perform a tick check. We don't always do this, but it can happen in cities as well. If you're out and about, just do a quick look at your body, come home, take off your clothes, take a shower to remove any of the ticks that might be partially on, and get someone who you trust to look at your body in this hard spot. So behind your ears, scalp, in your groin, and other areas. And also check your pets and make sure they're up to date for their tick, because we want to enjoy the summer, and the way to do that is to be careful, and we can still do so.
Are there any places that are more common, like on your body, or they will go anywhere?
So they can go anywhere, but they like warm areas. So like behind the ears and the groin area, scalp area is also an area. So you want to make sure that you are doing a proper review.
Gosh, Dr. Sheila,
We're all such emotional here.
I know, sorry.
That's such important information. Thank you so much. Thank you for watching, and don't go anywhere. We're going to be right back.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.